Hi, I'm Dr. Boomy, and we're going to be talking about scoliosis today. So, who remembers those days where all the students would be lined up to touch their toes and the school nurse would check everyone's back? Yes, they were looking for scoliosis. Now, what is scoliosis? It's the curvature of the spine, and it can come in infantile, adolescent, or adult. The infantile form is usually linked with illnesses and genetic diseases. The adolescent is the one we'll be talking about today because it is the most common. It is known as adolescent idiopathic scoliosis because we don't know what the cause is. It usually presents mild and does not affect activity. So that's why it's important to get a screening during your pediatric visits. So what kinds of signs would we see with scoliosis? We might see some uneven shoulders, uneven shoulder blades, uneven hips. We might see one shoulder blade protruding more than the other. We might see one side of the rib protruding more than the other side. And when the bend over test is done, your doctor might notice a curvature of the spine or a hump on one side of the back versus the other. Now, what if one of these signs are there? Then your doctor will use what we call a scoliometer, which is a cool little gadget. It basically looks like a leveler that a contractor would use in the house for your walls and your floors. And basically, if the scoliometer shows 7 degrees or more, then your doctor will order an x-ray. Now, the x-ray is for 2 reasons. One, it's to measure what we call the Cobb angle, which is the angle of the curvature, but it also is to look for skeletal maturity so that it'll tell us how much more growth the child still has. Now, with those 2 factors, we'll decide the course of treatment. So first, if the Cobb angle is 10 degrees or less, we do nothing, and we don't even consider it any kind of scoliosis or just very, very mild scoliosis. If the Cobb angle is between 10 and 20 degrees and the child is still skeletally immature, so still has a lot of growth potential, then we do closer observation, which means they do get checked every 6 months. Now, if the angle is between 20 and 24 degrees, we are still going to observe, but recommend some exercises to help strengthen the core, the back, and help with posture. Now, once the angle is 25 degrees or more and the child still has a lot to grow, then we do talk about bracing. Bracing is contraindicated in children who are already skeletally mature. Now, what is bracing for? It's not to correct the curvature. It's actually to halt the progression so that it does not go past the 50-degree curvature, because that's when we get associated skeletal deformities, we get back pain, breathing issues, and even psychological issues. If a brace is worn, it should be worn 18 hours a day on the average, and you should be following your orthopedic doctor every 4 to 6 months until, again, the child has reached skeletal maturity. Now, if the Cobb angle goes beyond 40 degrees, then we do talk about surgery. And even in the skeletally mature children who don't have any growth left, if the degree is 50 or more, surgery is still recommended. So I want you to take away a few things. Number 1, remember your pediatrician will be checking your shoulders, your child's shoulders, hips, back with every well visit. And please don't be surprised if 1 year there's nothing and then the following year there is scoliosis. Your doctor did not miss anything. Remember, scoliosis progresses and it worsens during rapid growth period. And that's why it's important to get a yearly exam. And I thank you for listening, and we will see you next week.